Hello everyone, you are on the channel Who Created It and How. Today we're diving into a topic that affects us all, yet we rarely think about its bizarre and sometimes terrifying history. Medicine. How did our ancestors deal with sickness and injury? What strange and wonderful methods did they invent? Let's travel back in time to uncover how they practiced medicine. Our journey begins in ancient Egypt, over 5,000 years ago. Egyptian doctors were surprisingly advanced for their time. They had specialized physicians for different parts of the body, just like we have specialists today. There were eye doctors, stomach doctors, and even dentists. Papyrus scrolls, like the famous Ebers Papyrus, reveal their medical knowledge. They believed many illnesses were caused by evil spirits or punishments from the gods, so treatments often involved a mix of magic spells, prayers, and herbal remedies. They would use things like honey, known for its antibacterial properties, and willow bark, which contains a substance similar to aspirin, to treat wounds and pain. But don't get me wrong, it wasn't all effective. They also prescribed remedies like crocodile dung and lizard blood. While they understood the importance of hygiene and had some knowledge of anatomy from their mummification practices, their ideas about how the body worked were still very limited. For instance, they believed the heart, not the brain, was the center of intelligence and emotion. Now let's jump over to ancient Greece, the cradle of Western medicine. Here we meet Hippocrates, often called the father of medicine. He revolutionized the field by arguing that diseases were caused by natural factors, not by gods or superstitions. This was a massive shift in thinking. Hippocrates and his followers developed the theory of the four humors: blood, phlegm, yellow bile, and black bile. They believed that a healthy person had these four fluids in perfect balance. Sickness occurred when one humor was in excess or deficient. So how did they restore this balance? A common practice was bloodletting. Doctors would cut a vein and let some blood flow out, believing it would remove the excess humor. They also used purging and induced vomiting for the same reason. While the theory of humors was completely wrong, the Hippocratic approach of observing symptoms, diagnosing illnesses, and prescribing treatments based on those observations laid the foundation for modern clinical medicine. The famous Hippocratic Oath, a pledge of ethical conduct for doctors, still influences medical ethics today. Next, we travel to the Roman Empire. The Romans were brilliant engineers and builders, and this extended to public health. They constructed massive aqueducts to bring fresh water into cities, built extensive sewer systems to carry away waste, and established public baths to promote cleanliness. These measures significantly reduced the spread of diseases. Roman medicine was heavily influenced by the Greeks. Many Roman doctors were actually Greek slaves or freedmen. One of the most famous was Galen, a Greek physician who served several Roman emperors. Galen was a brilliant anatomist, but his knowledge was based mostly on dissecting animals like pigs and monkeys, because human dissection was taboo. This led to some accurate discoveries, but also many long-lasting errors about human anatomy. For example, he believed blood was produced in the liver and consumed by the body, a theory that went unchallenged for over 1,400 years. Galen's writings became the ultimate medical authority throughout the Middle Ages, and questioning his work was considered heresy. Now let's enter the Middle Ages, often called the Dark Ages. But that's not entirely fair, especially in the Islamic world. While Europe saw a decline in scientific inquiry after the fall of Rome, the Islamic Golden Age was a period of incredible medical advancement. Scholars in cities like Baghdad and Cordoba translated and preserved the works of Greek and Roman physicians, adding their own extensive observations and discoveries. Figures like Al-Razi and Ibn Sina, known in the West as Avicenna, were giants of medicine. Avicenna's book, The Canon of Medicine, was a monumental encyclopedia that synthesized all known medical knowledge. It was so comprehensive that it was used as a standard medical textbook in European universities for centuries. Islamic physicians established the first true hospitals, with separate wards for different diseases. They developed new surgical instruments, made significant advances in pharmacology, and even understood the contagious nature of some diseases like tuberculosis, long before the germ theory was established in Europe. Meanwhile, back in medieval Europe, medicine was a mix of folk remedies, religious faith, and remnants of Greek and Roman knowledge. Monasteries became centers for preserving medical texts and caring for the sick. Monks cultivated medicinal herb gardens and provided what care they could. However, the dominant belief was that sickness was a divine punishment for sin, so prayer and pilgrimage were often seen as the most effective cures. Surgery was considered a lowly trade, often left to barbers. These barber surgeons would perform bloodletting, pull teeth, and even amputate limbs. It was a brutal business, done without anesthesia or any understanding of germs. Infection was almost guaranteed, and survival rates were shockingly low. The Black Death in the 14th century highlighted the complete inadequacy of medieval European medicine. With no idea what caused the plague, doctors tried desperate measures like lancing buboes and prescribing bizarre concoctions, all to no avail. The Renaissance sparked a new age of discovery, and medicine was no exception. A renewed interest in classical knowledge led scholars to re-examine the works of Galen and others, but this time with a more critical eye. The biggest breakthrough came from a brave anatomist named Andreas Vesalius. In his groundbreaking book, On the Fabric of the Human Body, Vesalius challenged centuries of Galenic dogma by performing his own human dissections. He corrected over 200 of Galen's anatomical errors and created beautifully detailed illustrations of the human body. This marked the birth of modern anatomy. Around the same time, a French surgeon named Ambroise Paré revolutionized surgical practice. He stopped the brutal practice of cauterizing gunshot wounds with boiling oil and instead used a soothing ointment. He also reintroduced the ancient technique of using ligatures to tie off arteries during amputations, which was far less painful and more effective than cauterization. These were monumental steps forward. The 17th and 18th centuries, the Age of Enlightenment, brought the scientific method to the forefront. In 1628, the English physician William Harvey published his work describing the circulation of blood. He proved that the heart acts as a pump, circulating the same blood throughout the body, completely overthrowing Galen's 1,400-year-old theory. This was as revolutionary to physiology as Copernicus was to astronomy. The invention of the microscope by Antony van Leeuwenhoek opened up a whole new, invisible world. He was the first person to see bacteria and protozoa, which he called animalcules, though he didn't connect them to disease. This period also saw the first successful vaccination. In the late 18th century, a country doctor named Edward Jenner noticed that milkmaids who contracted the mild disease cowpox seemed to be immune to the deadly smallpox. He famously tested his theory by inoculating a young boy with pus from a cowpox sore and then exposing him to smallpox. The boy didn't get sick. Vaccination was born, a discovery that would save countless millions of lives. The 19th century is where modern medicine truly begins. The pieces of the puzzle started to come together. The development of the stethoscope allowed doctors to listen to the heart and lungs for the first time. The true revolution, however, was the discovery of anesthesia. Before the 1840s, surgery was an agonizing ordeal. Patients were held down while fully conscious. Then, dentists like Horace Wells and William Morton demonstrated that ether and nitrous oxide could be used to render patients unconscious and insensitive to pain. Surgery was transformed from a last-ditch, butchering nightmare into a controlled, life-saving procedure. But another killer still lurked in the operating room: infection. This is where Louis Pasteur and his germ theory of disease changed everything. He proved that microorganisms cause disease and decay. Inspired by Pasteur, a British surgeon named Joseph Lister applied this theory to surgery. He started using carbolic acid to sterilize his instruments and clean wounds, introducing antiseptic surgery. Mortality rates plummeted. Suddenly, patients were surviving surgeries that would have been a death sentence just years before. As we move into the 20th century, the pace of discovery accelerated exponentially. In 1928, Alexander Fleming accidentally discovered penicillin, the first antibiotic. He noticed a mold had contaminated one of his petri dishes and had killed the bacteria around it. This chance discovery ushered in the age of antibiotics, turning once deadly infections into treatable conditions. The development of X-rays allowed doctors to see inside the human body without cutting it open. Our understanding of genetics exploded with the discovery of the DNA double helix by Watson and Crick in 1953, paving the way for genetic engineering and personalized medicine. We developed vaccines for polio, measles, and mumps. We learned how to transplant organs, perform open heart surgery, and develop treatments for cancer. From magical spells and bloodletting to gene therapy and robotic surgery, the journey of medicine has been long and incredible. It's a testament to human curiosity, resilience, and our unending quest to understand and heal ourselves. What do you think is the most amazing medical breakthrough in history? Let us know in the comments below. Thanks for watching, and don't forget to like and subscribe for more journeys into the past.